let's try again. Let's see what Baba has for us now. Oh, we're going to switch over to our 40 side now. Okay, so just keep in mind, this is not a detailed abnormality scan, so it's more a memorable experience for mom and dad, and also a little bit of bonding with Baba, all right? Okay, good. Oh, Baba's moving a lot. Can you feel it?
Well, I decided to do a 4D scan because a very good friend of mine told that it would be a beautiful experience and nice memory to build upon, and it would actually be your first time to see your baby in a complete different perspective. My experience with the 4D scan was quite emotional, but in a very positive way. I was tremendously thankful for the kind approach and the nice explanation, and also the clear way of explaining that this is not a diagnostic scan, but just a memory one can build upon.
There is a range of things that you can actually pick up on ultrasound, but we as general obstetrician gynecologists, when we do a scan, we usually look at the gross anatomy of the baby. That is looking at the structure of the head, the brain, the face, the neck, the spine, and the limbs, and some of the internal organs.
First trimester scans are normally done between 11 weeks and 0 days, and 13 weeks and 6 days, ideal time being at about 12 weeks.
The scans are usually used as a screening for syndromes like Downs, because there are certain markers that we can pick up, then they suggest that there is a possibility of a syndrome.
They normally do a quick evaluation of the entire fetus. They will look for a cleft lip, cleft palate. You get to hear the heartbeat as well, because they look to see that all 4 chambers are present and functioning normally. They look at the nose bone, the thickness of the skin of the neck, the long bones in the arms and the legs. They can often see the gender already as well, if you're interested in finding that out. And then they measure the blood flow to the uterus to look at the risk of growth restriction and preeclampsia.
Sometimes some gynecologists will do what we call serial growth scans, just to monitor the growth of the baby and to see that the environment that the baby is in is still, conducive for the pregnancy to continue.
Lack of growth probably more common than excessive growth. Excessive growth can be associated with certain congenital infections that might not be picked up previously in pregnancy. You might acquire an infection during pregnancy, and we only pick it up with your growth scans. You can also pick up excessive amniotic fluid, which could be an indication of things like diabetes, or certain congenital abnormalities that could be very difficult to pick up otherwise. And in terms of growth restriction, it's if you see that the tummy, for instance, isn't growing well, the Dopplers start getting elevated and your amniotic fluid decreases, you can identify this growth restriction, and we can, more often than not, you can intervene and manage the patient properly. Some babies might need to be delivered sooner rather than later.